Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, friends. Welcome to this week's episode of the Healing Pain Podcast. I am your host, Dr. Joe Tatta. On today's episode, we're discussing transgender and LGBTQ health with Dr. Alivia Stehlik. Alivia is a queer trans woman who is currently on active duty in the U.S. Army, where she serves as the medical team leader and physical therapist for the 3rd Security Force Assistance Brigade at Fort Cavazos, Texas. Alivia's work centers on Army medicine and advocating for queer youth, as well as transgender military members, so that they can live their best, most authentic lives. The focus of today's episode is on affirmative and inclusive care for lesbian, gay, bisexual, transgender, and all queer people in the military, in physical therapy practice, and all throughout healthcare. Okay, without further ado, let's begin and let's learn about inclusive care with Dr. Alivia Stehlik. Hi there, Alivia. Thanks for joining me this week.
It's so nice to be here, Joe.
I'm excited to speak with you. Our listeners heard a brief introduction about who you are and some of the amazing things that you're doing in the couple moments previous here. And I mentioned that obviously you're a physical therapist, you're leading medical teams within the military, and then you have this big advocacy part of your life, which is so needed right now. So I'm really excited to speak with you. And I know our community is really interested to hear your perspective and a lot of things that you have to say and a lot of your lived experience. What would you like our listeners to know before we start off that may not be in that kind of more simplified professional bio?
Yeah, well, the first thing is kind of like we've said is that I have to give my standard disclaimer that I'm here as my own individual human being, not as a representative of the Army or the Department of Defense. And so all of my views are mine and not either of the departments. But I don't know things about me that I want y'all to know. I think that I am really passionate about this advocacy work. I think that I didn't intend to be, honestly. I kind of stumbled into it, which is maybe how most of us find ourselves there. But I didn't grow up with this kind of idea that I was going to come out and be some kind of big advocate. In fact, I didn't actually grow up knowing that I was trans in those words. And so it took a while. And then once I came out, as it turns out, in the military at the time, there were only a handful of officers who were out and trans. And I, as a 6'2" tall woman in the Army with a Ranger tab, people find you, right? It becomes quickly obvious who I am. And so I just decided to go with that.
Yeah, give us an idea of where kind of, I guess, how your Army career has intersected with your physical therapy career and how that came to be.
So really funny, actually. I did the kind of stereotypical Army family thing where my dad was in the Army. And then I loved my job. I was commissioned as an infantry officer in 2008, and I loved the time that I spent with soldiers. But I looked at all of the folks who were doing the jobs that incidentally now I'm at the right rank to do, and none of them were happy. None of them liked the jobs they were in. None of them, I thought they worked too hard and didn't have enough balance, and they just didn't seem happy. And so I realized I needed to do something else. And as it turns out, the Army has a physical therapy program. The funniest part of that is that I didn't really understand what physical therapy was when I applied to the program. I didn't have any physical therapy experience as a young person. And I mostly thought I was going to help people work out better and work out more. And the story I love to tell is that I think we were about 3 months into PT school, and I leaned over to whoever was my desk mate, I can't remember at this point, and I said, "This is like a lot of medicine." And they looked at me and they were like, "Who let you in here? What did you think this was going to be?" And as it turns out, it's been really lovely. I love the medicine, actually.
It's interesting because people get into physical therapy for different reasons, right? some people are into it because they want to be a little bit more in the health and wellness aspect of things. Some people want to work more with, kind of an inpatient environment. How have you started to take your advocacy work in the trans community? And I know a lot of your advocacy work is within the military, correct?
It's focused really around, at this point, honestly, just allowing trans people to exist and to serve openly and to be able to access healthcare that's related to transition. That has been, I would say, the vast majority of my advocacy is there. But what's been neat is that as that has happened, folks in different places have reached out and have said, hey, would you be willing to come talk to us about this? There's this funny thing that I have this Army experience, but I also happen to be a healthcare provider, right? I happen to be a medical provider. And so that has had this odd synergy of you're a patient of a kind of interesting subset, you're a provider in a specific, kind of avenue of healthcare that's related to bodies, right? And interestingly, so is trans healthcare in many ways is related to bodies. And so I think there's been this fascinating, to me, overlay of both my lived experience as an Army officer, which is a very physical profession, and then also the fact that both my medical profession and my gender identity also have a lot to do with bodies in some way.
Yeah, it is interesting. I mean, you definitely sit at a pivotal point, really, I mean, right now in history, when I think about everything that's happening in the health professions with regard to really practice guidelines around LGBT healthcare and the disparities that exist for that population. So you're right in there with, obviously, as you mentioned, a medical degree and background and your lived experience. Then we have this whole sociopolitical context that has been brewing in the United States with different laws being passed in different states and jurisdictions around healthcare. A lot of it revolves around, I think, children and adolescents. What is happening within the military as far as one's ability to transition and for them to receive the medical care that they need and require?
That's a really complicated question, as you might imagine with any large bureaucracy. The short answer is that within the federal, Department of Defense entity, transition is still allowed and accessible, albeit at varying levels or with varying levels of ease or frustration, depending on, what unit you happen to be with, where in the country you happen to be, what the landscape looks like. It's interesting, and in some places you have really, really good and lovely experiences. And in general, I have had really good experiences wherever I've been. I was last stationed in Colorado, and now I'm in Texas. And obviously, those landscapes couldn't be more different, politically speaking. But from an Army perspective, I haven't experienced a significant difference, other than that, each hospital has its own character. And really, much like anywhere you go, things are dependent on who's there, right? The rules or the regulations or the policies across the Department of Defense are fairly static in the sense that they don't change quickly. We've had some fluctuation, obviously, over the last couple presidencies with allowing trans folks to serve, and then there was the ban was in place again, and what is the legal status of trans folks in the military? But from a procedural standpoint, it's fairly static and written down, but it still requires somebody to care and to be able to do that work, right? Like here's the block of instruction, if you will, but somebody who's a provider still has to be familiar with that block of instruction, has to be willing to walk through the paperwork, has to be, know who to talk to. So it can be very complex, even if it's allowed.
So it sounds like it's one, it's legal and allowed. Two, the policies are in place, but it may be difficult
They are.
to find a provider that understands how to transition someone from beginning and throughout the entire process based on the medical system, so to speak. And I think that's common in all healthcare systems at this point in a lot of ways, right?
Absolutely. I don't think that that is a DoD specific issue. You know, the DoD has its own what's the word? Idiosyncrasies, right? The DoD has its own little things that you have to finagle and work through to make a system work. But just like you said, that's not different than any other healthcare system in terms of there are personalities at play, there's insurance and billing and diagnoses and all of these different, you know, things that have to happen. And some cases it's much, much easier. Some places of the country it's much, much easier. In other places it's much more difficult and potentially in some cases now impossible without leaving a state.
What have you learned through your navigation of the healthcare system and transitioning that you'd like to share with other healthcare systems or policy creators, or maybe even insurance companies that you feel would be beneficial to the LGBT community in this area?
I mean, I think the first thing is that people matter, right? And that's all of the people. That's our patients. As a patient, I learned how frustrating it can be, right? And I'm a provider in a system that is fairly socialist, right? Inside the military healthcare system is fairly socialist as an insular system. And so even in that, where I'm a provider and have really good contact with other providers, it was still challenging at times to get the pieces in the right place to put together this puzzle of getting the right care and of sequencing that with my job requirements and moves and deployments and things like that. And so if as somebody in a fairly, you know, closed system healthcare who is a provider, if I struggled at times to make transition work, I think about if you're just out there, you know, kind of in the wind on your own, if you don't have familiarity with the medical system, I think that's really tricky. So I think that first piece of just people matter, and we're all just trying to make it work as best we can. I think that there's some amount of, one of the things I do with my patients is I try to educate them on how our healthcare system works. Because often the folks who come see me for very different reasons than being that, you know, than trans patients might be the, you know, you might be the first provider a trans patient sees, but I often have patients that haven't seen a physical therapist before or haven't seen a provider because they're concerned about their career or something else. And so there's a discussion of, I find it really important to teach them about, like, here's how the system works, right? Like, I will help you, I will be your provider, but also I think I have an obligation to tell you about how the system works and what the possible outcomes are and where we can send you if my care doesn't resolve what you have going on. So how do we, and not just at my local installation, but as you move throughout your career, who are the kinds of providers you might need, or how do you access that care? Because it's, generally speaking, to folks who aren't employed in the medical sector, I think that it feels much like a black box of, I don't know how this works. And so I think that's one of the things, is educating folks about the system, because then we have a more synergistic approach to, it's not me in the system trying to talk to somebody who has no idea what's going on. It's together we both can work through the, you know, the processes. I think that helps, and it also builds relationships, right? If I'm trying to teach you about how the system works, and you understand part of how my job works, which facilitates this ongoing relationship that we're going to have to be in to get you better.
Have you started to see how your advocacy work with the trans community, with the LGBT community has, I think, how has it impacted you as a physical therapist, knowing that body awareness is obviously a body awareness wrapped up in this conversation, and we work with the human body on a daily basis. And, to this day, like things like trauma-informed care, psychologically informed care are things that physical therapists are increasingly more aware of, but yet they don't necessarily have a solid foundation in it unless they're particularly interested in it and go out and seek that type of training to learn how to affirm people from the LGBT community, which we really don't have in physical therapy training. We don't have training on how to affirm patients from these backgrounds. How do you think that one, who you are, and two, the things you've learned personally can apply to physical therapy practice?
Yeah, I think it varies a lot, honestly, right? There's what happens in an individual patient interaction and encounter. That's one piece of this. And then there's what do we do at a systemic organizational level, both from I'm the administrator of a physical therapy practice or healthcare system, or a physical therapy school from an educational perspective. How do we encompass or wrap our arms around at least touching on some of those things, right? Without dramatically expanding the scope or the length of physical therapy school, there are some limitations on what we can do, but I think that there are some things. I'll say that my personal practice has shifted a lot, and shifted first really with this idea of trauma-informed healthcare. And I don't really remember exactly what first kind of kicked that off for me, but there's a whole sector of patients that I started realizing, you're not responding the way I expect you to respond to a physical therapy evaluation or intervention. And in talking to some folks and eventually working through that, I had this realization that, folks who have some trauma don't respond the same way. We don't respond the same way psychologically, but we also don't respond the same way physically. And obviously, this has been an ongoing education for me. The first time I read The Body Keeps the Score, I was like, this will be great for my patients. And I'm rereading it again in this current, I didn't see myself in that book the first time. And I'm rereading it at the suggestion of my therapist. And, the last 6 months have been particularly awful for the trans community. I've started to ask this question of, what if you don't have post-traumatic stress? What if you're just still in the middle of the trauma, right? What if all you're trying to do is survive? Mm-hmm. And so that has been this ongoing thing for several years for me, but really acutely in the last several months, is how is this idea of getting better related to my body and to fear and to survival. In talking about different interventions we perform, I have really, for years now, been much more likely to talk about pain and pain science and fear of movement than I am to talk about mechanical structures, which always surprises my patients. I think, we grew up in an environment in the Army and really in PT, I think I certainly feel that when I went through school, we didn't really talk about pain science at all. And my internship director was incredible and has absolutely shaped my whole career as a physical therapist dramatically for the positive. But I think that has been this idea of bodies. What do we do with bodies? How do we inhabit our own body? How do we feel comfortable there? And that's, I realized at one point early in transition that I probably picked the wrong profession as a trans person, because you have to touch everybody. I was like, this might not have been, maybe I should have been a radiologist. Nobody would have had to know. I would have sat in a dark room. But here I am, I have to touch all of my patients. And so that, it ended up being fine. As it turns out, I've had good experiences, but that was, I had some concerns. I think as you move into the role of having a clinic or a company, or I think there's a lot that we can do, right? There's little things that you can do, right? There's the idea of, I don't have a rainbow sticker on my truck, car, business, whatever, because I need it. I have it there so that somebody who needs to know that this is a safe place knows that this is a safe place. Of course, there's the inherent commitment there. Then if you say that you are a safe person or a safe place, then you have to do the work to be a safe person or a safe place. Your staff has to be trained. You have to be trained. You have to know, what are the things that I can and can't say, or should and shouldn't say? How do I make somebody feel welcome? And really, that's, you said earlier that the military system is just like any other system in that it's a complicated system. The same thing is true when we talk about people and being welcome, right? What happens if you look different than me, right? What if you grew up, you have a different accent than I do? If you have, a different number of limbs than I do because of trauma or because of birth, or if you have a different, you have different trauma than I have, you have different parents than I have. What if you didn't grow up with your parents? There are so many things that we don't think of as trying to be more inviting or accepting or aware of. But my personal belief is that all of that stuff affects who we are. And we should be aware and ask those questions and say, hey, I just want to know who you are, because all of that ties into your body and your experience of the world.
Really well said. Because I've heard a
really long answer.
No, it's a beautiful answer. And I think it makes me kind of think of this. I've heard some of our colleagues say things like, well, I don't work in a big city, or I don't work in a big hospital system where I'm going to come across a trans person or an LGBT person. It's just not what happens in my practice. And as I listen to you speak, I really think the things you say, the things you're saying, and things you're educating people about, when I sit back and just think about it for a minute, is not only are the things you're saying help you treat people from the LGBT community in an informed way, but those same principles really apply to all humans that we treat.
They do, right? And I think that we can say that without saying or without negating the significance with which the LGBT, and particularly the trans community, is currently being attacked, right? I think that there's this, sometimes we have this sense that if we generalize everything, that it then says, well, the specifics don't matter. I think that, but I don't think that that's true in this case. I think I can't remember which of my favorite writers talks about this, but there's this sense of, and I have been here, where in some introductions, I have said, I am white, I'm a lesbian, I have a doctoral degree, I grew up in, the upper middle class, I'm probably upper middle to upper class at this point, right? Like all of these kind of caveats to just narrow this is who I am right here. And all of those things are true. And I don't want to necessarily speak for anyone else. And there's also this importance, I think, in saying that the human experience is fairly universal. And so while there are groups that have much more significant marginalization and have been systemically mistreated, across whole swaths of society, I think that when we narrow ourselves too far, we lose that community in saying, like, yeah, my specific struggles aren't the same struggles that you have, right? Like I have never had to deal with the things that my Black friends have, right? When one of my first squad leaders talked about getting pulled over routinely in high school in his parents' Lexus, in a fairly wealthy community. And you're like, how is that a thing, right? And I didn't understand, and I had never experienced it. And my experience has forced me to sit, or has encouraged me, or have chosen to sit and listen and just trust that people's experience is what they say it is, which should be our normal, and often is not. I've spent a lot of time apologizing for not having done that before, and recognizing, oh, everybody has a different experience than I do. And there's a pretty broad section of human society that shares in experiences of pain or mistreatment. And so how do we treat people as human beings and recognize that what they say about themselves and what they've experienced is true.
What do we need to do in the physical therapy community? That could be, that obviously probably spans the topic from DPT education to DPT practice to, professional development and things like that. I mean, I went to PT school in 1995 is when I started. And, very shortly after the AIDS crisis, and other than HIV prevention in my program, there was nothing in the curriculum about LGBT health at all. You mentioned we touch people, and the pelvic health profession particularly is deeply entrenched in affirmative trans care in many ways.
Yeah, I mean, that has been one of the areas that I have been asked to come talk is with pelvic health programs specifically around this, and which has been lovely to have that folks who are aware that, hey, maybe I need to talk to somebody who has this lived experience or has some education in this and understands the medical piece of this. Because I do have a very odd intersectional identity in some ways that, as I talk to my, medical friends who are providers, there is a sense of, hey, it is important to take people at their word and to understand that trans people, among others, are going to have a lot of specific knowledge about their own conditions, right? Much like I've had friends who have, if you're the parent of a child with a rare disease, right? Often when you go to the doctor, you're going to know more about your kid's disease than they will, unless you're seeing the one specialist or the two specialists in the world or the country that treat that, right? The same thing is true in general, I think, for trans folks and providers. And what I've encouraged my providers on is to say that, hey, it is important for you to listen and take seriously your trans patients about their healthcare. And you're still a physician, you're still a physical therapist. You still have the education, but B, the obligation to treat appropriately, right? To use your medical knowledge at its best. And so I think the tricky piece is, how do you marry those two, right? How do you bring those two things together of, I need to evaluate you because you've come here for me to evaluate you, and this could be uncomfortable because bodies are challenging when you're trans, or when you're not what you think you should grow up to be, or when your body doesn't look the way you want it to look, or when your body has changed over time, or there are so many other, like we said, right? There's this isn't just about being trans or being part of the LGBTQ community, but I think, and that's actually what frames how I think of what we should be doing better as a profession, is to say, right, like, how do I make you feel welcome, right, as a patient, to say that, if I walk in and I don't look the way I want to look, or you think I should look, or for example, I can't tell you how many of my patients have come in and said, oh, I'm sure that my knee pain is because I'm overweight. I'm like, I don't, maybe not. But also, like, if you acknowledge, like, if you come in and tell me that, then I don't need to even have a conversation with you about that. You are already doing way more about that, right? You're already addressing that. You're already beating yourself up for that. So it's my job to say, hey, actually, what if we could just look at what actually is bothering you, right? Or if you need help with that, I will help you with that. But also, let's look at your knee, back, whatever, shoulder, and say, I don't have to do this thing that clearly you have been blamed for in the past, right? That you have gone in to see a provider and they have said, well, this hurts because you're overweight. Or, we call it trans broken arm syndrome, that people, they can't set your broken arm because you're trans. They're like, it's probably related to being trans. And you're like, I fell out of a tree and broke my arm. Like, it's not, those things aren't related. And people have those experiences. But I think there's this sense of meeting people where they are. And I think what I call the soft skills, I don't really know that that's the right name, but just how do we encounter people? how do we make them feel safe in general, right? I thought that me being trans was going to be a complete disaster in the military. I'm not going to lie. But what I found is that when I was out, all of a sudden people are like, oh, well, you clearly have stuff, so I can talk about whatever I want, right? And you can take that a lot of different ways, right? There's some laughter, and then there's also some seriousness of, if I can be authentic and vulnerable, then so can my patients. I've opened the door, for me, perhaps simply by existing, but maybe for other people, that's putting up an equal sign, or maybe that's recognizing, oh, this person walks in and they've clearly whatever thing. How do I listen and take that all in and then ask insightful questions about the things that really matter, right? Your relationship to your own body. I'm afraid to move. I'm afraid to try, right? Those are really big general answers, right? I think that there's we want to have this, oh, well, if I just do these 3 or 4 things, then we can make the world better. And I was thinking about this last night, and just when I think about the political climate in the world right now, and kind of how I grew up, I think there's this sense that the rules make us feel safe, right? I think we have this idea that having rules or tightening things down, narrowing things down is what makes us feel safe. But I don't actually think that's true. I think it's the love and the relationships, right? I use love, I'll be all woo-woo, but say that this idea of truly caring about somebody, no matter who they are. We could be diametrically opposed on so many things, and I can still care about who you are as a patient or as a human being. And that's actually what makes us safe. It's not the rules. It's not the did the 3 things to make trans people feel safe. No, that's not how this works. It's I treated you like a human being, or my kid, or my uncle, or my grandparent, or and that's how we feel safe.
I've heard other practitioners say, well, this is all great and wonderful, and I'm glad we have, this developing, but even though I'm a licensed healthcare professional, this is against my religion, or these are against my personal views, or my morals and ethics don't align with the things you're talking about. So on the one hand, you're talking about an obligation, and they're saying, well, here's why that should be a caveat or a cutout for me. Here's why that obligation doesn't apply to me personally. What is your response to the healthcare professionals out there who would say something like that?
I mean, I have a spicy response, and then I have a nuanced response, right? I think that, and interestingly, it's not dissimilar from how a lot of people talk about the military in some ways, right? That there's this narrative that trans people can't do their job in the military, they're a burden, or what have you. That's the line that gets repeated often, that we decrease the readiness of the Army. And I talk about being a physical therapist in Afghanistan because somebody else couldn't go, so I took their spot. And I think we treated 1,700 patients in the 9 months that I was there. So there's this clear, that's just literally not true. But I think maybe rather than give my spicy response, I think that perhaps being in the military and being really passionate about combat medicine and about taking care of soldiers tells me, or leaves me with this idea that when somebody's dying, it doesn't matter who they are, right? We take care of you, we save you, we try to save your life. That's what healthcare truly is all about, right? Is at its base, we're trying to save people's lives, and that gets much more forward when you're in a life and death situation. But I would argue that it's just that the appearance of the stakes being higher. The stakes aren't actually higher in that situation, right? The stakes that you and I encounter our patients in every day are also the stakes of their life, right? That what we do or don't do for them is a matter of their life or not. And maybe they're not going to die because of what we do or don't do, but their life is going to be better or worse. And so it's just difficult for me to understand. I can't imagine a patient in the world that I wouldn't treat. It doesn't matter to me what you believe, and I really mean that. You could be a person who deeply believes that trans people shouldn't exist, that trans people should not have the right to exist. And as a provider, it's still my job to take care of you and to do the very best that I can. Is that going to be tricky for me? Is there some big cognitive dissonance about that? Sure, probably. But much in the same way that we ask soldiers to go and do their job and potentially give their life, to me, that's what we do as providers, is to say, I am voluntarily waiving my life in the sense of how I would choose to live or my judgment about moral whatever. My job is to take care of other people regardless of who they are, simply because they are people and people are worth saving.
Alivia, thank you for joining us today and for really lighting a path for us. I think the things that you're doing are, we need so much more of this right now, obviously in the queer community. And I'm so happy that there's someone within, peer of mine really in physical therapy that I can turn to, has both the lived experience and the medical knowledge to really, I think the way you can move in and out of these conversations is something that very few people have the skill to do. So I'm just so honored for you to be here and to speak with us. But I'd love people to learn more about you and share your work and invite you to the things that they're interested in. So how can people follow you and your work?
I mean, I'm on Instagram as @ShowPonyLive. That's probably the easiest way to find me. And I'm so honored to have been here. Thanks for the opportunity. And obviously, the more I get to do this, I hope that we get to make a difference in the world together.
And we'll link to all your social media handles. I know you're on Instagram, and I believe you have a LinkedIn. We'll link to that so people can go to the show notes at the integrativepainscienceinstitute.com. And you can find all of Olivia's information there, her bio, her background, and the various ways you can contact her. And I really encourage you to reach out to her and speak with her about some of these topics. I think that, a 40-minute single podcast episode on this, we really just start to, skim the surface on these topics. So with that, I ask you to share this episode with your friends and family on your favorite social media handle, wherever anyone is talking about affirmative LGBT care for the community. And just keep in mind that this is Pride Month, so this message may go even further if you share it this much. I want to thank Alivia for being here again. I'm Dr. Joe Tatta, and we'll see you next week.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit integrativepainscienceinstitute.com. That's integrativepainscienceinstitute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.